Thank you very much, Deputy Presiding Officer. It gives me great privilege to lead for my party in this debate, and I move the motion in my name. In her first speech to this chamber after the 2016 elections, the First Minister was very gracious in paying credit to my party when she announced the creation of a ministry for mental health and a minister in that regard. It is something we had fought for many years, and we were gratified to see it made real. But after 2 years, that sense of common purpose we shared that day has all but evaporated. We can no longer find consensus with a government which consistently lets us down on so much on an issue of such importance. Because, Deputy Presiding Officer, we live in a Scotland where less than half of new mothers are served by adequate perinatal mental health services, where we see waiting times for child and adolescent mental health services the worst on record and outperforming that every single month. And we see 1,000 adults waiting a year or more for access to a talking therapist. We also saw last year that terrible statistic that against a steady decline in recent years over the implementation of the Choose Life suicide prevention strategy, we saw the first rise, an increase of 8% in the number of Scots taking their own lives in this country. The government response to this has been an additional £30 million in the last budget and more money announced today, which won't even cover the 800 link workers that they have already agreed to deploy, and 2 monstrously delayed strategies which have been roundly criticised by the sectors in which they will be implemented. Now, I'm not here to make enemies, Presiding Officer. I like to think I treat everybody in this chamber with respect, but against that powerful index of failure, I am compelled to ask the Mental Health Minister, what exactly do you do all day? Now, the eyes of the most vulnerable in this country are fixed on this Scottish Government for answers, for solutions, and for care, and they have been left wanting. And we celebrated the creation of this ministry. It was a staging post. It was the first part of a much bigger vision for a comprehensive, gold-plated, copper-bottomed service that would look after people who are mentally unwell from infancy until the end of life. But we see at every level deficiencies in policy and in provision at every single stage in that process. I said at the start, if you are a new mum in Scotland with anxiety or depression as a result of your pregnancy, there's less than half likelihood that you will be seen by adequate perinatal mental health services, and there is no standardized training of GPs, midwives, or health visitors. If you're a child with any kind of trauma as a result of an adverse child experience, the chances are we don't even know about you because we are not capturing that information. I thought it was very telling, Presiding Officer, that former Chief Medical Officer Sir Harry Burns, when he was giving evidence to the Health Committee about his review of NHS targets, said that the one thing we should be measuring, that we are not measuring, is those young people who have experienced adverse childhood experiences. Similarly, if you are a young person, you are identified, and you do have anxiety or depression or self-harming behaviour, you can wait up to 2 years for first-line treatment. And in terms if you need admission for Tier 4 crisis bed support, there is every chance that you will be turned away because, just in a second, because there are insufficient staff there to tend you. I'll give way to Neil
Finlay.
Thanks very much. Last week during Carers Week, I met with a group of young carers to speak about their lives, and 10 out of 14 of them told me that they had to be referred to CAMHS, most having to wait an extraordinary length of time, and some the result of self-harm, etc. Some were given advice to go to a website. That is clearly not sufficient.
I'll give you a little time back.
Thank you, Deputy Presiding Officer. I agree with Neil Finlay, absolutely, and I think it underscores that group who are most vulnerable, who are already delivering a service that we exploit the love of for the care of the people around them, that we should look after them in their time of need as well. So bad is CAMHS that Chief Officer of North Lanarkshire, Janice Hewitt, said that referrals in child and adolescent mental health services have risen in Tier 3 and severe by 23%. There is something not right, she said. There is something that we are not doing right with families or children. This was to the Health Committee in evidence. That was the red warning flag we should all heed. Put simply, Presiding Officer, if your daughter fell off her bike and broke her arm, you could reasonably expect her to be in plaster by the end of the day. But if she came to you with anxiety or depression or even self-harming behaviour, you could then expect her to join the longest queue in our NHS. It is simply not good enough. But it doesn't get better when you transit to adult services either. Those two are characterised by long waits and a fractured continuity of care. Many of us in the Health Committee heard very compelling stories by families bereaved by suicide. And one person talked about their loved one who had, in his last 5 months of life, had appointments with no less than 5 psychiatrists. You would not expect a cancer patient to have to see 5 different cancer surgeons. And every time he had to start at the beginning, retell his story, and potentially re-traumatize himself at that. There is no support for families in how to look after somebody who is experiencing suicidal tendency. No provision for non-English speaking citizens, for people who are from other countries for whom English is not their first language. And precious little training of police. It's only optional at Teliano. We need to make that mandatory because it is often the police that form that all-important first response. I should also say, this is not a reflection of how I view our hard-working healthcare staff, who are absolute champions of the health service, and they deserve our respect. They only want for training, capacity, and adequate resources. But it is the sharpest end of this agenda that I think should cause us all great concern. That 8% increase last year against a marked period of decline in suicide, those Scots taking their own life. Now, Tony Giuliano said in the Health Committee yesterday from the Mental Health Foundation that there is no longer strong ministerial guidance to local communities on directing money towards suicide prevention. I wholeheartedly agree with that. I hope that the government listened to his message. Presiding Officer, we've come a long way in this country in getting people to finally talk about mental health and to come forward, but we do them profound harm if once bringing them out of the shadows, getting them to recognise the problems that they are experiencing, if we then have a void of services to offer them. That is a cruelty that is just unconscionable. So I say enough. And today I'm asking the Parliament to take this department under special measures and ask it to bring forward plans to delineate how it will turn this situation around. The mental health strategy was 500 days late and panned by stakeholders. And let's be clear, and we often hear the First Minister say that's because of the Health Committee, of the 68-week delay caused to that mental health strategy, only 3 weeks of that was caused by the Health Committee. And I won't hear anybody say otherwise in this debate. But the suicide strategy, we are still waiting for, more than 500 days late. And in those 500 days, Presiding Officer, 1,000 fellow Scots have perished at their own hands. It is a human tragedy. I'm coming to my end here. It is a human tragedy that is visited on the north shore of my constituency every single week. My party can no longer excuse the deficiencies in this government or its minister. So I say to the minister, do your job or make way for somebody who will. Thank you.
Thank you. I now call